Scene size up, primary, secondary assessment. I have my BSI. My scene size up suggests that there are no hazards, no weather concerns. I have one bystander. I have one patient, and no need for additional resources at this time. The mechanism of injury was a squash racket to the left-hand side of the head. My general impression is that I have Randy, a 35-year-old white male, who is awake and alert. I'm going to begin checking his level of consciousness, but before we go any farther, my partner is going to assume control of the neck, back, and cervical spine. So I say, hello, Randy. I'm Philip. This is my partner. We're going to be taking care of you. I need to ask you a few questions. I ask him who he is, where he is, what day it is, and the events that led up to where we are right now. Having answered those questions accurately and without any difficulty, I am suggesting that he is awake and alert. I listen to the airway. I see that it is patent and adequate with no obstruction and that there are no adjuncts necessary at this time. No breath sounds. And the chest is moving evenly. He is breathing at 20 breaths per minute with a regular rhythm and an unlabored quality. The carotid pulse is 60 with a regular rhythm and a strong quality. I will expose the patient at this time and I will do a chunk check. However, before I do that, I would like to note that the skin color, the color, temperature, and appearance of the skin all appear normal. So I'm going to do a chunk check where I'm looking for any liquids that may have settled to the bottom of the patient. I look down. Back. Looking. Good. Now I take a history, looking for signs and symptoms, allergies, medications, previous medical history that's pertinent, last oral intake, and the events leading up to where we are right now, which would conclude the primary assessment. Moving on to the secondary assessment, still in BSI, partner is still holding traction of the neck and the back. I'm going to check the bones of the facial region and the jaw. I'm going to examine the front of the neck, looking for any abnormalities. I'm going to feel the back of the neck. Okay, everything looks good. At this time, if we had a collar, we would put the collar on, but since we don't, my partner is going to continue to hold traction. The patient has already been exposed. I'm looking at the chest, looking for any bleeding or bubbling. I'm going to check the stability of the shoulder area. Good. I'm going to check the stability of the chest and the sternum, all the while looking for any reactions of pain. I'm going to put my thumbs on the chest on either side, looking for equal chest movements. Good. If I had a stethoscope at this time, I would be checking for lung sounds, breathing sounds in 4 areas, starting here. I would move to here, and then here in the axillary region. And I would compare as I moved through all of those. Then I would look at the posterior back, all the while looking at my patient, talking with my patient. Then I would do the abdomen in all four quadrants, one hand on top of the other, looking for pain responses and rigidity. Okay, then I'm going to push the hips in, again, checking for stability. And then I'm going to go down the limbs, looking for any abnormalities, and as I do, sliding down, ensuring that I remember the size of those limbs for comparisons. I'm going to move down. Good. When I get to the leg, I'm going to ask, can you wiggle your toes? Can you push against? Can you pull? I'm going to look for capillary refill. I'm going to check a pulse. I'm going to check the Babinski reflex. By the way, that pulse is going to be the dorsalis pedis pulse. And I'm also going to look for any medical alert bracelet that might be present. Then I am going to do the same on the right leg. I'm comparing the size of the previous leg. Good. And I get down to the right foot, where again I'm going to ask Randy, can you wiggle your toes? Can you push against? Can you pull? I'm going to check capillary refill. I'm going to check the Babinski. I'm going to check the pulse to make sure that they are even. Good. Also going to check for a medical alert bracelet on that right foot. Then I go to the left arm and I do that same examination as I did on the leg. I get to the hand. Can you wiggle your fingers? Can you squeeze my hand? I look for a medical alert bracelet. I take a pulse. I look for capillary refill. And I pinch the skin looking for tenting. I do the same over here. I'm checking. Good. And I get to that right hand. And I ask if he can wiggle his fingers, if he can squeeze my hand. I look for a medical alert bracelet. I pinch the skin. All of that. Good. Now, I have a pulse, I have a breath rate, I have lung sounds, and I've examined the skin and for its color, its temperature, and its appearance. Had I a blood pressure cuff, I would at this time take the blood pressure from the left arm, and I would make a note of that. My reassessment is that the patient has a bruise on his left temple. I found nothing, no other injuries, so we're going to package him and take him to the nearest emergency department.